Hey guys, welcome to Pittman Parenting and the birth of baby number 2. We'll spare you the raunchy footage. Today's episode is for the expecting mom, part 2, the birth. Now these are meant to be watched in order, so if you haven't seen part 1, go back and watch that. That is pre-baby. Obviously there's not going to be any instruction in this video. This is simply a advice video. It is more about just to tell moms to relax and stop being scared of everything that everybody's telling you to be afraid of, and make the decisions that you want to make, and don't let anyone judge you for them. There's a million different things you can do, and there's a million different things that can go wrong. But I can assure you that worrying about all those different things are not going to keep them from happening. If anything, it's only going to increase the chances of them happening, because putting yourself and baby under stress only makes things worse. And the best thing you can do is to relax and plan for everything to go correctly. And should you come to any of those complications, you'll cross that bridge when you get there. For instance, this is our second birth, and first was induced, and it was a vaginal birth. We're planning the same thing this time, getting induced again. Got an epidural the first time, planning on doing it again this time. There's many things that can go wrong, and if we happen to have any issues, we'll address those when we get there. But I just want you guys to remember, you know, if you choose vaginal, no epidural, induction, waiting on baby to come when baby comes, no matter what you do, it is your choice to do. It has nothing to do with anyone else. Talk to your doctor or your doula or whoever is helping you get through the birth, and outside of that, be happy with your decision and don't let anyone else influence your decisions. At the end, it's going to have to do with you and your baby, and that's all that matters, is the safety of mom and baby getting out safely. And what's pretty cool is, like in this instance, yeah, I wanted to be in a hospital because I wanted to make sure that we were in a place, if any complications arose, that they would be equipped to handle them. What's really cool is this specific hospital, they turn their really large rooms into birthing center rooms. So basically you get to have the experience of a birthing center in a hospital. Should anything go wrong, you know, it can be handled. But you can't get any epidurals, you can't get anything but the
nitrous.
Nitrous, that's right. Goes on your face, and you...
That's it?
That's it, that's all you get. If you choose that, that's awesome. If you choose all natural with no medication, that's awesome. Whatever you choose to do, that's what matters, and that's fine. Just go with it, and don't let anyone shame you for any decision that you make in this situation. Just wanted to say that, and we will see you after the baby's out, and we will show you what's going on and finish this episode up with after the baby's born.
You can wake up and tell everybody hi. Say hi.
Alrighty guys, we are here with baby number 2. This is the continuing part of the expecting mother, the birth. Wanted to talk to you guys a little bit after she was here. And the best thing I can say for this part is relax and be happy, and I know we all have a birthing plan and we try our best to stick to it, but sometimes things don't happen the way we want, and that's okay. And you just take that step and cross that bridge when you get to it. We are blessed enough that we've had now 2 very healthy vaginal births. Nothing wrong with babies, and she latched a lot quicker. We used the pause method again. Last night was her first night on Earth. And she did a lot of self-soothing, and by the morning she doesn't even do the whimpering anymore. She's way easier than our firstborn. He had to be pretty strictly self-soothed and trained and everything, and she's just a natural. She's a lot easier. And like we said, every baby's different, so you're gonna get a different thing each time. Now I would like to go over a list of things that most people don't tell you and that are very normal for babies. Yes, newborns have weird shaped heads. That's normal for vaginally birthed babies. Yes, newborns are jumpy due to their startle reflex. This is normal and usually begins decimating around 3 months. Newborn baby girls and boys can have enlarged genitals due to the pressure from birth and fluid buildup and hormones. Newborns can eat a lot. This is totally natural and healthy. As long as they are continuously on the healthy growing curve, there's nothing to be concerned about. They tend to have cold hands and feet. Their circulatory system is developing, and it's their blood supplying the more vital organs first. As they become more mobile and active, their blood circulation will improve. The same maternal hormone that is responsible for swollen testes and labia can also cause small amounts of blood discharge in baby girls' diapers. This is common occurrence, and before panicking, ask your doctor or pediatrician. Newborns develop nursing blisters or calluses, which is normal. Newborn stool is very runny, anti-diarrhea-like, especially for breastfed babies. Newborns sneeze a lot to clear nasal cavity. Newborn skin is very flaky as they are shedding dead skin from change of environment from the womb to the outside world. Newborns' breaths aren't always regular. A pause up to about 20 seconds is considered normal. By the time she or he is about 6 weeks old, your baby should develop a more regular pattern of breathing. You worry about SIDS, of course, and you're wise to be vigilant. Put your baby to sleep on her back, keep all soft bedding and toys out of her crib, and don't smoke. If your baby ever stops breathing for longer than 20 seconds, or turns blue or limp, seek medical attention. Telling between different cries is not automatic. It will kind of all sound the same at the beginning. Over a few weeks to a couple months, you will begin being able to tell the difference, especially as babies' lungs and vocals develop. One more thing, I've noticed a couple lumps under each nipple area of one of our children, but not both of our children. It only affected one. I called the pediatrician, and she said that it was completely normal, that it just has to do with hormones, and that it can last up to 6 months, but usually clears up within a few weeks. As long as you don't notice any blood, redness, and there's no fever, there should be no reason to be concerned. But again, if you are, just consult your pediatrician. You may notice a lip quiver. It's usually the bottom lip, and it is not them shivering. They actually don't even possess the reflex to shiver to warm their bodies back up. It's just a simple lip quiver that will eventually phase out. Tiny little pimples on newborns is just baby acne. It will clear up in time. If you are truly concerned about any issue, don't drive yourself insane Googling everything and self-diagnosing. Simply consult your pediatrician. Also, an extra tip for the birth that we got from our Bradley birthing class was to bring treats for the nursing staff during your birth. They work really hard and they definitely appreciate the treats. We brought our nursing staff treats both times. And this was part 2 of the expecting mother, the birth. And we will see you guys later. We're going to take her home and then we'll see you guys for part 3. Bye guys.
Bye-bye.